Medicare is one of those programs that seems pretty straightforward. It's basically healthcare for when you retire, right? Well, yes, but what it does and doesn't cover isn't always as clear. So today we're going to talk about the 5 most important things covered by just plain old original Medicare to help you better understand where the coverage starts and where that coverage ends. Hi, I'm Michael, and this is Michael's Medicare. Any of you or somebody you know is trying to figure out what is that best Medicare option for them during the AP or really all year round, give us a call at the information down below and we'll be happy to help them through those tough Medicare choices. Also, don't forget to like and subscribe. So let's talk about Medicare and what are the 5 most important things that it covers. And when we are talking about Medicare, in this case, we are talking about just original Medicare. So that is Medicare Part A and Medicare Part B. Medicare Part A generally doesn't have a cost to it, at least monthly. That is paid from all the years we had been paying into it or been taxed for it while we were working. But Medicare Part B does have a premium that in 2025 is $185 a month, and it has to be paid if and whenever somebody is enrolled into Medicare Part B for every month they are enrolled. Part A covers primarily things like hospitalization. So that would be, big surgeries, emergencies, where you get admitted into the hospital and major operations. And then Part B, on the other side of that, covers the more day-to-day care. Things that would be probably, hopefully, more often used than, Part A, at least ideally. So with that overview of what is covered by original Medicare, let's talk about what it covers in specifics, that is, dollars and cents. First things first is going to be hospital coverage. And what that specifically means in 2025, because it did change from 2024, is that for major things, not necessarily emergency room visits, but things where one is admitted into the hospital, the way the coverage works is there's a one-time per benefit period deductible that has to be paid, and then there is a daily rate per day after that spent in the hospital. So that means there is a Medicare Part A deductible, which in 2025 is $1,676 per benefit period. A benefit period is the first 60 days that somebody spends in the hospital per occurrence. For each benefit period, this initial deductible must be paid whether it is 2 days in the hospital or 59 days in the hospital. The Part A deductible just has to be paid for that totality of 60 days. Then, if someone is unfortunate to be stuck up in the hospital for more than those 60 days, so let's say day 61 through 90, there is then a daily cost of $419 per day someone spends in the hospital. Once a person reaches that 91st day, that is when they reach a daily cost, an increased daily cost of $838 per day until somebody reaches their limit of their lifetime reserve days, after which point they're going to be responsible for their own full cost, which needless to say at that point is probably going to be a lot. So I think one of the most assumed things that are covered by original Medicare, that is Medicare Part A and Medicare Part B, is doctor visits. And no surprise, they are few, right? But to what degree, I ask? This is because for Medicare Part B coverage, in general, it will cover 80% of those costs for doctors' services, but not always. First off, for just the Medicare Part B portion, that is the day-to-day usage coverage, there is going to be a one-time per year annual deductible that would have to be paid first of $257. But again, unlike the Medicare Part A, which is yearly, the Medicare Part B is per year. So once it's paid, that's all you have to do. There's no per benefit period. After that, for most doctor's visits, the beneficiaries will be responsible for 20% of the cost that is set out and negotiated by Medicare with the doctors for payments. This is where things get a bit tricky because if your doctor doesn't accept Medicare assignment, the Medicare negotiated cost, the doctor can still accept Medicare patients, but may be able to charge those beneficiaries up to 15% more than they would have been paid by Medicare under something called the Medicare Part B excess charge. Now, all that being said, even with the excess charge, it can be considerably less money than someone would have to pay with a under 65-year-old plan, whether that's through work or through school or through a spouse. But it's not just as cut and dry as you slap down that beautiful red, white, and blue card and away you go. Another important coverage that I think is not often thought about is going to be under the Medicare Part B portion, which is for drugs. Now, I know there is a Medicare Part D plan or PDP plan that covers folks for their prescription drugs, and everyone has to get it or else they could be penalized for not having it. But under Medicare Part B coverage, there is some coverage for drugs, but they are primarily medications that are received while under a doctor's supervision. Now, I know with a lot of our clients, this would be something like a steroid shot for arthritis, some cancer drugs, or other doctor-administered drugs in those doctors' offices. So not the ones that you would get from the pharmacy. But this is a really important coverage under Medicare Part B, of course, when someone actually does need it, because those medications are quite expensive. Also, just because under Medicare Part B, you may have some specific drug coverage, you still gotta get your Medicare Part D. Please and thank you. When someone first gets to Medicare, there are actually a whole litany of preventative tests and screens that one will have access to. First is the Welcome to Medicare preventative visits, which can be done within the first 12 months of being enrolled in Medicare Part B. Now, there is no cost for this visit, and it is probably the closest things that someone would get to with just original Medicare to a checkup, but it is not an annual checkup like you may have gotten every year, hopefully, if you do it right. If you are studious with it, when you were on a under 65-year-old plan, it was automatically included. Some of the other interesting and exciting preventative screenings that are available on just original Medicare, though, is screenings for diabetes, cardiovascular disease, alcohol misuse, mammograms, lung cancer screening, and really a whole lot more. Of course, this makes me wonder how many folks get the full Monty, all the screenings and tests that are available in that first year on Medicare. I don't know, but I guess at that point it's more of a hobby. Last up for today, that is going to be covered under Medicare Part A, under the hospital coverage portion, is skilled nursing facilities. Now, this is separate from hospice care or hospital care because skilled nursing facilities generally are designed to provide skilled care for rehabilitative services, but not designed to be a permanent housing and healthcare solution. They are more designed to get someone back to well and be able to return home, but not lifelong assistance. Skilled nursing facilities are covered under Medicare Part A, but they are still subject to the deductible, the daily and lifetime limits that hospital stays are subject to. So overall, Medicare is a great program, and in fact, one of the most successful public programs in the history of the United States, at least thus far. But obviously, it doesn't cover everything and has sort of been left to its own devices without the necessary updates it needs to keep up with the current needs of Medicare beneficiaries right now. And who knows by the time my generation gets there where it'll be at. But it is still a huge part of one's elder care and can be augmented with things like Medicare Advantage plans or Medicare supplement plans that can help with the cost of the coverage of health care. All right, so with that said, I hope you all enjoyed this video, and really, I hope you all enjoy all of our videos. And if you or somebody you know has questions about their Medicare, please feel free to reach out to us at the information down below. Either me or somebody from my team will be happy to assist them in person or over the phone at one of our many offices across Southern California in English or Espanol. So for Michael's Medicare, I'm Michael, hoping you have a great rest of your day, and goodbye.